So I've been asked to talk a little bit about weight and how when we're carrying a little bit of extra weight, that can have a real impact on our lower back. Really the message is that if you are carrying a little bit of extra weight, trying to address that and lose some of that weight will really help with your lower back pain. Keeping active, so keeping exercising, as we've just heard, is really vital, and hopefully as a result of that then some weight loss will occur as well. You might be interested to hear that one statistic I found is that 1 in 9 people has back trouble that compromises everyday living. So this is something that so many people are living with, but if we could do something ourselves to try and mitigate that, it's got to be worth a try. It won't work for everybody, but it may work for some. It's got to be worth a go. Okay. So a lot of people are very aware of the link between carrying a bit of extra weight and, say, heart attacks, strokes, type 2 diabetes, those sorts of conditions. But what people are less aware of, perhaps, is the difficulty of the correlation between carrying extra weight and lower back pain. But it's something that, if you're addressing that for your back pain, the good news is that will have an impact on your stroke risk, probably, your type 2 diabetes risk, those sorts of things. So it's something that's worth addressing for your general health as well as for your lower back pain specifically. There's one American doctor who said this quote, that every single patient in his clinic who loses a significant amount of weight finds their pain to be vastly improved. So if you're carrying weight, the idea is that pretty much you're certain to have some sort of improvement in your pain levels. And it's interesting to think, well, why is that really? If you think about it, the spinal cord carries the whole weight of your body. It's an awful lot to ask of your spine. So if you're then carrying extra weight, you're asking extra of your spine, asking it to work even harder. There's 2 main things. First of all, your muscles are having to work a lot harder if you're carrying extra weight, but also the shape of your spine. It can exaggerate the natural curve of your spine. It makes you hold your back more differently if you're carrying some extra pounds. So if you are reducing your weight, you're reducing the strain on your muscles and the strain on your back as well. So, as it says here, carrying the weight around the tummy, it pulls the pelvis forward, tilting it and stressing your spine unevenly. And that makes it that everything's kind of out of alignment. And your leg muscles also can become overworked, and that has an impact on your back as well. Really importantly, Tamsin was talking a little bit about if you are going to have surgery, if it's a route for you, if you're carrying extra weight, that can have a real impact on your recovery. So actually what a lot of patients are finding is that even if their back issue might require surgery, they're being asked to lose weight first. Now the idea of that is that when you come out the other side, that then you're going to be able to recover a lot more quickly. So that's something that's really important to bear in mind. So when we talk about weight, carrying a bit of extra weight, what do we mean? Sometimes it's a bit difficult to know if we are or if we're not. You know, we kind of look at the people around us and we think, oh, well, you know, I'm a similar size to that. But actually, having a real good idea of what your BMI, or body mass index is really useful. As it says here, it's something you're possibly not likely to do at home, work out your own BMI. So dividing your weight in kilograms by your height in meters, then divide your answer by your height again. You know, it's a bit of a palaver. So if you come and see 2 lovely people, Josh and Hattie in the corner, they can work all of that out for you and let you know where you lie on that scale. Ideally, staying within 10 pounds of your ideal weight is going to be the best thing that you can do for your back. So a BMI of 25 to 29.9 is considered overweight. And that might be a surprise to a lot of people because it doesn't look very big, actually. You know, you might think, oh, I'm okay, but you might actually be in that overweight category without really realising that you've slipped into it. BMI of 30 plus is considered obese. So again, all of these things are things that we at 1U East Sussex can help you with. We've got a number of weight loss programs, which I'll talk a little bit about after the coffee break. Really interesting, this one, I think. If you've got a BMI of 25 to 29.9, so if you're in that overweight category, it's increasing your odds of back pain by 20%. So equally, if you become a healthy weight, if you get yourself out of that bracket, then you're going to reduce your likelihood of feeling that pain. If you are obese, if you've got a 30 plus BMI, it's doubling or tripling your likelihood of having back pain. Now that again goes on with something that Tamsin was talking about exercising. Actually, if you are overweight or if you're obese, you're less likely to be exercising daily. So all of these things kind of work together. It's the carrying the weight, but it's also the lack of movement, which is something you might need to address. And that just keeping movement, keeping your joints working. Really interesting, I don't know if any of you know this. If you're a smoker, you're 3 times more likely to develop lower back pain than if you're a non-smoker. Now the reasons for that is because if you're a smoker, then that can reduce the size of the blood vessels carrying blood to your lower back or the rest of your body. Not only can that have an impact on pain in the first place, but a bit like being overweight, if you do go for surgery, it has a really large impact on your recovery, your ability to recover from surgery if you're a smoker. And so that's why if you're always asked that. You know, if you go and see a clinician, then you will be asked if you're a smoker usually. And certainly if you're going to be referred for surgery. And it's something that the surgeons will want to see you try and address first. And again, I'll talk to you about our Stop Smoking program and how we can help you do that if that's the category you come into. Now, if you've got back pain, that can cause a fear of exercise. You know, you don't want to hurt yourself. You can be worried about causing more damage. As we've learned today, pain doesn't necessarily equal damage, but it can be a fear, can't it? And a problem with that is that then you're more likely to put on weight. If you've put on some weight, then that's more likely to exacerbate the back pain in the first place. So you get into this really understandable but vicious cycle. And it's something that once you understand a little bit more, that it's something that you might need to address, then hopefully you can start to put in steps to implement change. Exercise for weight loss, as we've heard, strength training is really important, about muscle control. I don't know if anybody knows what the recommended guidelines are for a healthy person for exercise. What are the government guidelines? Anyone know? No? Sorry? The government guidelines for exercise are 30 minutes a day, 30 minutes of moderate exercise a day. And when we say moderate exercise, that's actually quite different for everybody because it should leave you a little bit breathless, a little bit out of breath. So that's not running marathons. For some people, running marathons might keep them a little bit out of breath. It wouldn't for me, but for some people it might. So everybody's idea of moderate exercise is different, but 30 minutes a day. That can be broken down into 3 10-minute slots. But if you are a healthy person and you're trying to get your heart rate beating, get a little bit out of breath, then 3 10-minute slots a day is absolutely perfect. And that can be done in the home. That could be hoovering the house. That could be some vigorous gardening, perhaps. It doesn't have to be going out and joining a gym, that sort of thing. So obviously, when it comes to walking, cycling, bicycling, they're things that are kind of low to medium impact, so it has less effect on the joints. So they're things that you might want to think about. So our adult weight management program, again, I will address this a little bit more later on. We've got a big 10-week program that we run at 1U East Sussex, where we help you to lose weight. There's lots of education about food and nutrition as well. So it's not just all about movement, but it's kind of a whole body exercise program. The good thing about that is you also, as a bonus, get a free pass to the gym and the swimming pool as well. So you can use that as much as you like during the 10 weeks that the program is on. I'll talk to you a little bit more about that later on. We also have something that's for men only, which is a Man v Fat football program. And this is for men with a BMI of 27.5 or above. It's national, it's endorsed by the FA, and it is one of these brilliant, absolutely fantastic, extremely competitive, but definitely worth talking to us about if you want to lose a little bit of weight and you're a man. You can come and have a chat with us. The other options are that you can come and work with our health coaches just on a one-on-one, and that's about setting goals for yourself about exercises, a little bit like Tamsin was doing earlier. You know, what are your particular goals? What are things that you want to achieve? And that might be that you want to increase your ability to kind of stand up and down from the chair from 5 times in 30 seconds to 8, 10 times in 30 seconds. So we can work with you on your own goals. Thank you.